Welcome to our channel. If you want to understand your health insurance card, follow these step-by-step instructions to decode the information and use it properly. Step 1. Locate your member ID number on the card. This unique identifier is required when scheduling appointments, filling prescriptions, and submitting claims. Step 2. Identify the insurance company name and customer service phone number. Call this number for questions about coverage, claims, or to find in-network providers. Step 3. Find your group number if you have employer-sponsored insurance. This identifies your employer's specific plan and is needed when verifying coverage. Step 4. Check the plan name or type. This tells you whether you have an HMO, PPO, EPO, or other plan type, which determines how you access care and coverage rules. Step 5. Look for copay amounts listed on the card. These show what you'll pay for common services like office visits, specialists, emergency room, and urgent care. Step 6. Note the prescription drug copay tiers if listed. These numbers indicate what you'll pay for generic, preferred brand, and non-preferred brand medications. Step 7. Check for separate pharmacy and medical provider customer service numbers. Some insurers use different numbers for prescription and medical coverage questions. Step 8. Verify the effective date and ensure the card is current. Using an expired card can cause claim denials, so confirm you have the most recent version from your insurer. Don't forget to like this video and subscribe to our channel.